Good evening, everyone. Today we are going to start Unit 5, that is Hospitalization Indemnity Products in India. So what is this Hospitalization Indemnity Products in India? First, here we will see a proverb that is called health is wealth in need a reality, and if health is lost, everything is lost. Yes, if health is lost, really everything is lost. And today, if we see an hospitalization event, once a patient is being hospitalized, okay, there is an erosion of the lifetime saving amount of the person, and there are certain cases of financial indebtedness. Okay, and here mainly what is happening is there are people mainly facing the consequences of this hazards. This financing the cost of the health has become a very serious problem of concern of all the individuals and also the family members in the society. Okay, and here next we have the health insurance policies that are available in India are indemnity policies and agreed value policies. So in detail, we are going to see what is this indemnity. Indemnity is nothing but here this indemnity policies are. So first we will see what is this indemnity. So this indemnity is nothing but it is a security. One thing you have to remember is indemnity is nothing but it is a security or a protection against a loss, or it may be any financial burden or any free from loss of the person. Okay, and it is a policy, mainly this is a policy that will help the individual to provide the reimbursement benefits for the actual expenses which are spent by the person for his treatment in the hospitalization or during hospitalization. So indemnity is nothing but it is a security or a protection against a loss, or it may be any financial burden or a free from loss. So mainly this policy is helping to provide the reimbursement benefit for the actual expenses which are spent by the person during his treatment of hospitalization. And next, nowadays, if you see this hospitalization expenses have become very high, and even a common man cannot afford this expenses. And if you see, not only a common man, even a financially sound man also, it is difficult for him also to bear this expenses unless and until he is having a good health insurance policy. Okay, because nowadays this surgical procedures, the medical expenses, the pharmacological management, okay, the investment during the hospitalization is become very costly in the hospital. So here we have certain health insurance products. So what are these health insurance products? Nowadays, these health insurance policies in India, like they are available from rupees 5,000 in micro insurance policies companies, and even it goes to like rupees 50 lakhs also. Okay, some of 50 lakhs. So this is advisable, and it is recommended to make or to take certain or to obtain enough coverages from during early age itself. Okay, during early age itself, because if you take the room rents of hospitalization, the other expenses during the hospitalization are very much increased nowadays. And next, there are three categories to design health insurance products. So what are the three health insurance products? Are indemnity covers, fixed benefit covers, and critical illness covers. So first we will see what is this hospitalization indemnity. So first we will see what is this indemnity cover. So what is this indemnity covers are nothing but here what happens to the indemnity covers here, mainly the insurance policies that protect against the financial losses that results from certain events, such as if you take any property damage or any legal expenses. So mainly this is designed to protect, mainly this is designed to protect the professionals, the business owners, when they found it to be a fault. Okay, when there is a fraud or when there is a certain fault, this policy, this indemnity cover will help the business owners and the professionals. Okay. The next one is fixed benefit cover. So what is this fixed benefit covers? This is also known as hospital cash policy. Okay, this is also known as a hospital cash policy. So in this event, the hospitalization here, what happens is mainly the insurer will pay a predetermined amount irrespective of actual cost. So here what happens is a certain amount per day spent in the hospital, or and also a certain amount that is additional per day spent in ICU is paid. And again, if you take even during the surgery, okay, a certain amount is paid during an event of any surgery if the patient is posted for any surgery in the hospital. Okay. And mainly this is because here this provides protection to the insured person. Okay. This fixed benefit covers will protect a benefit, or it will provide a protection to the insured persons, whereas this will also help insurer mainly to price the policy for a reasonable. Okay. Mainly it will have a reasonable price of the policy. And also this charges, okay, this fixed benefit covers will have charges towards their diet, transport, and also an ambulance, etc. services. And next one we have like critical illness cover. So what is this critical illness covers? This policy mainly it will cover the conditions during, the name itself is telling us what is it, critical illness cover. So mainly this policy will cover a condition that are related to critical illness like heart attacks, strokes, or organ failure, any transplantations, or any internal cancers, etc. So mainly this simple, it's very simple that this will support financially if insured is diagnosed with any one of the conditions which I have been explained now. Okay, either any critical conditions. And mainly this critical illness is required for prolonged care. Post hospitalization is post hospitalization may happen, and it is advisable to take critical illness cover as an extension in an hospital indemnity policy. Okay, this will help to overcome the financial burden. And next, you have this hospital indemnity product. So what is this hospital indemnity products? Mainly this will cover the medical expenses in the event of hospitalization, whatever the expenses that are medically uh, aroused for the patient during an event of the hospitalization, and for a specific number of days, that is before and after hospitalization, that is pre and post hospitalization. And it also, and this will exclude any expenses that are not involved in the hospitalization. And this policy will pay the actual expenses or amount that is spent during the hospitalization. It will pay only the actual expenses, not the extra expenses. Here you have an example. Mr. Sham, his wife and son have taken a Mediclaim policy covering each member against rupees 1 lakh sum insured. Okay, here the maximum limit is rupees 1 lakh per head in case of hospitalization. So if Mr. Sham has incurred rupees 1 lakh 25,000 due to hospitalization, the policy would pay only rupees 1 lakh because he has taken a Mediclaim policy that has been covering against only 1 lakh. Okay. So what about this remaining 25,000? This remaining 25,000 should be paid by Mr. Sham from his pocket. Hope you understood this example. And next we have this inpatient hospitalization expenses. So what the name itself is telling you, what is this inpatient hospitalization expenses? So this indemnity policy will pay the insured the cost of hospitalization expenses that are included in the account of illness or the accident. Okay, mainly here if we discuss, this policy will pay the insured or the policy holder the cost of hospitalization expenses. So this hospitalization expenses may not be like uh, payable for like most products. Here in this, they define the expenses covered with normally are the room rent, okay, and room expenses, the nurses expenses, the nursing care expenses, the ICU expenses, the surgeon anesthetic, the medical practitioner consultation and specialist fees. All these are included in this inpatient hospitalization expenses. If you see this dialysis, chemotherapy, radiation therapy, okay, and prosthetic device that is implanted during the surgical procedure, like example, if you take any pacemaker, vascular stents, okay, implants, etc. And again, if you take, there is another example for us. So here what happens is there should be minimum 24-hour stay in the hospital. Okay, the patient have to admit in the hospital or stay in the hospital for 24 hours. That is inpatient. This includes in the inpatient hospitalization expenses. So nowadays, if you take the related to the medical technology, because of advanced medical technology, the patients require or may not require 24 hours of hospitalization, because if you take this eye surgeries, chemotherapy, dialysis, okay, here what happens, the patient can take such type of treatments as a daycare centers or the hospital. He can admit or he can visit the hospital, he can stay in the hospital like around for 24 hours, or within 24 hours he can use the benefit of or he can use the treatment that is being available from the hospital, and he can be discharged. And next we have this outpatient or daycare treatment expenses. So what is this outpatient? The name itself is telling you outpatient. The patient just comes to the hospital and he will receive certain treatment from the doctors, okay, and he may have certain investigations related to his diagnosis. So the patient just comes in an outpatient basis, and he will just get his treatment or any surgical procedure which is undertaken under, it may be a general anesthesia or a local anesthesia in a hospital. And as we discussed, a daycare center is just less than 24 hours because of the advanced technology. Now, this advanced technology has become an advantage for the patients and also for the hospital people. So, this health policies will not cover the outpatient expenses. Okay. And here what happens is, sorry, the health policies do not cover the outpatient expenses, whereas, however, there are certain plans. Okay. What happens is, once there are certain plans that covers treatment as outpatient. Here what happens, if you show the records of the doctor visits, the medical regular medical tests, the dental checkups, or the pharmacy cost. So if you show certain things, there are certain plans that may cover the treatment as an outpatient. And next is pre-hospitalization expenses. So what is this pre-hospitalization expenses? This hospitalization, it could be either like any emergency hospitalized, or it may be a elective or an emergency. Elective is nothing but it is planned by your doctor. Your doctor may advise the patient to join the hospital as early as possible to receive this treatment, to receive the treatment. And next, if you see and next, yeah, if you see in emergency hospitalization, the patient may visit the hospital because of his any emergency illness or an injury. If you see here in this pre-hospitalization expenses, mainly there are certain medical expenses that can be incurred immediately before the injured person is hospitalized. Mainly the medical expenses that are incurred for the same condition, okay, in which same condition in which the insured person's hospitalization was required. And again, the inpatient hospitalization claim for such hospitalization is admissible by the insurance company. The insurance company should admit the claim that is being claimed or which has been admissible by the hospitalization. And this pre-hospitalization expenses that could be like in a form of diagnostic tests, the medications, the doctor fees, etc. All these expenses are relevant, and that can be covered under the health policies. The next one is your post-hospitalization policy. So what is this post-hospitalization policies or post-hospitalization expenses? So mainly after the discharge from the hospital, after your patient has been discharged from the hospital, so whatever the expenses are there, that will be related to the recovery and the follow-up. It is related with the recovery of the patient and the follow-up checkup of the patient. So here the medical expenses that are incurred immediately after the injured patient is discharged from the hospital, as we have discussed earlier. Okay. And next, this if you take this post-hospital expenses, could be either in a form of medications, that is pharmacological drugs, review by the doctors, etc. after discharge from the hospital. So why, when the patient is being discharged from the hospital, what is the diagnosis? It should be noted. And after the patient is being discharged from the hospital, okay, the follow-up should be related to the inpatient or inpatient hospitalization. Okay, so such expenses may be related to the treatment that is taken in the hospital. So mainly what happens, the duration of the cover here, this pre-hospitalization expenses may be like around 30 days and 60 days of post-hospitalization. So the patient may cover his post-hospitalization expenses in 30 days to 60 days. And next, coming to the domiciliary hospitalization. So what is this domiciliary hospitalization? Mainly this domiciliary hospitalization is nothing but it means the medical treatment that is provided to the patient at home when otherwise would have been provided in the hospital. When your patient is being unable to get admitted in the hospital, or when your patient is unable to receive his treatment in the hospital. Okay. So when the patient is taking a treatment in the hospital is related with your domiciliary hospitalization. So there are certain conditions where your person, for example, simple cough, influenza, hypertension, fever, diabetes mellitus, okay, simple or a minor disease conditions may not be covered under domiciliary hospitalization. And next is your pre-existing disease. So what is this pre-existing diseases? Any condition, okay, any conditions or any medical illness or injury where where the individual had before they have started taking a new healthcare plan, and it is considered as a pre-existing condition. Okay, so here you have certain things or certain conditions where this pre-existing diseases are not covered under the pre-existing health conditions. This corrective surgery for refractive error, treatment of sexually transmitted diseases, donor screening charges, admission registration charges, hospitalization for evaluation diagnostic procedures, and expenses for investigation, treatment, and irrelevant to the disease for which admitted or diagnosed. Okay. And next you have a cover that is called fixed benefit cover. So what is this fixed benefit cover? So this fixed benefit cover is nothing but as we have already seen. Okay, so this fixed benefit cover is also called as a hospital cash policy, in which in an event of an hospitalization, the insurer will pay a predetermined amount irrespective of the actual cost. Okay, so for example, they will pay certain amount per day that is spent in hospitalization, and certain amount is being paid or additional amount is being paid per day that is spent in an ICU. So this policy lists out common occurring treatments such as ENT, ophthalmology, obstetrics, gynecology, and the packages. This package charges would include all the components of cost such as room rent, professional fee, diagnostic, okay, diagnostic drugs, and pre and post hospitalization expenses. And next we go into a topic that is health insurance products for senior citizens. Yes, for senior citizens also, health insurance is very, very important. So here, this is a type of health insurance plan that covers medical expenses incurred by the people above 30 years of age. Yes, about 30 years of age. And this offers or this will provide this products for senior, this health insurance products for senior citizen. Mainly they will provide preventive health checkups, facilities, and cashless hospitalization at network hospital of the insurance company. Network hospitals are the team of, it may be a team of hospitals or team of doctors that are rendering the care for the policy holders. And this will also benefit the financial assistance for the hospitalization for the senior citizens as an inpatient due to their injury or any disease or any illness during the policy period. And next here we have certain guidelines of IRDAI where the individuals should be allowed, okay, the senior citizens should be allowed to buy a new health insurance policy up to the age of 65. 5. There should not be any limit, or there should not be any rejection of the proposals related to the health insurance for the senior citizens. Okay. And next, if you see, no insurer should refuse. Okay. The insurers should not refuse the renewal of the health insurance policy except under the grounds of, like, if there is any fraud, or if there are any moral hazards, if there are any misinterpretations, then only we will not renew the health insurance policy. Other than that, the insurers should not refuse the renewal of the health insurance policy for the senior citizens. And here the premium charges should be fair, justified, and transparently disclosed to the policy holders. Okay, it should be fairly disclosed for the policy holders, and the insured should be informed. Okay, the policy holder should be informed in writing that about any undertaking charges. Okay, if there are any additional charges that has been taken under the consent of the policy holder, each and every information should be informed to the policy holder, and a consent signature should be taken by them. And all the health insurance policies and TPA, that is third party administrators, shall establish a separate channel to address the health insurance related to their claims, related to their grievances. Okay, any advantages and disadvantages, and or any if they need any support for the senior citizens. So a separate channel should be there so that they can easily approach the senior citizens. And next, we have certain international coverage products. So what is this international coverage product? So this international coverage products, this medical insurances are a secondary emergency coverage for the people who are leaving their home country. Okay, it may be India, example, and this will provide coverage while they are outside the country, outside their country. Okay, when they are under trips, when they are for the work, and when they are outside work outside the country. Okay, so this international coverage will help the people or the policy holders when they are out of the country. So there are certain companies here that are offering the health insurance policies for overseas treatment in India. For example, you can see that is the Care Health Insurance Company, Max Bupa Health Insurance, and Cigna TTK Health Insurance, Apollo Muchin Health Insurance. So these are good companies that are offering the health insurance policies for overseas treatment in India. And next, we come to a topic that is wellness product. So what is this wellness product? What do you mean by this wellness? Okay, here you can see in images. Okay, what is mean? Okay, good nutrition is important, rest and sleep is important, physical activity is important. Okay, good organ functioning is important. Yes, all these are very important for us to maintain wellness. Wellness is nothing but it is a uniqueness of each and every individual that they experience. Okay, each and every individual have a unique kindness of wellness. So what is this wellness? It is nothing but it is an act of practicing the healthy habits on a daily basis. Yes, we practice it in our daily basis. Why? To attain or to maintain a better physical, mental health outcomes. Yes, physical health is important, mental health is important. At the same time, social health also is important. So this all comes under wellness. Okay, and we have a wellness product. So what are these wellness products? The wellness products are nothing but the products that are referring for us, that are designed to support or that are enhancing our well-being. Okay, which are helping us to build the wellness. For example, if you take the standards or the things that are important are which are promoting the healthy lifestyle. For example, if you take diet, nutrition is very, very important. Okay, balanced nutrition is very, very important, which will help us to promote a healthy lifestyle. Exercises are very important. Yoga is very important. Rest and sleep is very important. So all these are the healthy lifestyle practices which will promote the healthy lifestyle and which will promote the wellness of the person. And these products, this wellness products also will prevent illness and it will improve overall health in an individual. So here we have like 8 dimension of wellness. in a diagram, you can see there are multiple dimension of wellness. So in detail, we will see what are these 8 dimensions. First one is emotional dimension. So what is this emotional wellness? Emotional wellness, it is nothing but it is the ability where you have to be successful enough to handle the situations in life, the stress in life, and you have to adapt. Okay, the individual, it is important for an individual to adapt the changes in the difficult times. Okay, you should not give up during your difficult times. So what is an example for this? You can take emotional wellness activities. What you can do for your emotional well-being, you can do yoga, and also you can do a meditation, etc. Okay, and next one is environmental wellness. So what is this environmental wellness? This wellness involves having a good health by occupying a pleasant environment. Okay, pleasant working environment and a living environment is very, very important. And also to have a safe and healthy environment is very, very important for our environmental wellness. It's nothing but you should have a pleasant, supporting well-being that should include your living environment, and your working environment should be safe and healthy. And next one is financial wellness. So what is this financial wellness? Finance is very, very important, right, in our lives. Yes. So this includes balancing the income and expenses. So how much income you are getting and how much you are uh, having the expenses, you have to balance it, and you should stay out of debt. Again, if you have debt, you may not have financial wellness. You may land up into emotional imbalances. Okay, you may fall into an emotional imbalance where here you may not have emotional wellness. Okay, so saving is also important for our future. And this financial wellness, if you have proper saving, if you can balance this income and expenditure that you have, this will help in the alignments with the personal values and desires in the individual's life. And next, coming to the intellectual wellness. So what is this intellectual wellness? Intellectual wellness is nothing but mainly engaging in the healthy mental activities. Always you should have an exploring new ideas, etc. That comes under your intellectual wellness. And next, coming to your occupational wellness. So what is this occupational wellness now? Mainly here, the ability to have a balance between work and your leisure time. Mainly this way you can promote your health, right? It's related to one's attitude about one's work, about the your occupational or the way you work in your organization. Okay, and next, coming to your physical wellness. So what is this physical wellness? Again, or whatever we discussed earlier, mainly this is to recognize the physical activity. Mainly the healthy lifestyle is very, very important in the physical wellness. Having a healthy food, rest and sleep is very, very important, and regular follow-up checkups are also very, very important for the physical well-being. And next, coming to your social well-being, here mainly this is here we can be able to maintain good interpersonal relationship with the social networks, nothing but with your society, that will give you a support and satisfaction. If you maintain a good relationship with your society, with your neighbors, you will have certain support from your neighbors, as well as you have a good satisfaction around the people around you, right? If you do not maintain a good interpersonal relationship with your social networks, you may not have support from them, as well as you may not have a satisfaction behavior towards your society. And the last one is spiritual wellness. So what is the spiritual wellness here? Mainly this is expanding a sense of meaningful life, where you have certain ethical principles, your values, your morals related to your spiritual wellness. Okay, this comes under your spiritual wellness, having certain ethical principles, values, and morals. Okay, and this ethical principles, morals, wellness are being developed from your childhood itself, which starts from your home. And next, it goes on to your schools, where your teachers will be teaching us about this ethical principles, morals, etc. And next, here you have certain health specific services that provided by network providers or other hospitals. So here there are certain network providers, or it is nothing but your hospitals that are providing certain health specific services. For example, if you take outpatient consultation and treatments, pharmaceuticals, okay, health checkups, and giving discounts on your diagnostic procedures, giving discount on your outpatient consultations, etc. Okay. And here, if you see in your yoga centers, in the gyms, and in your sport clubs here, and certain fitness center, what they do is they avail you certain watches, yes, for as a membership, watches for membership for participating in the fitness activity that you have been involved in the health uh, wellness programs. Okay. So hope you understood this topic. Thank you.